Hi, I'm Dr. Scott Chavers. I'm an epidemiologist and I'm head of COVID-19 response for the Mobile County Health Department. Today is January 25th. I'll be giving the expanded COVID-19 update as well as the update on COVID-19 vaccines. So from our expanded report, we are reporting a cumulative number of 31,617 COVID cases. That is a rate of 7,652 cases per 100,000 people. Approximately 75% of these have been laboratory confirmed. The rest, the 25%, have been confirmed either epidemiologically or they are through the rapid test system. If you look at the last 14 days in Mobile County, we had the highest number of cases on 12 January with 297. The range over our last 14 days have been 161 at the lowest through 297. We're averaging approximately 215 cases per day. If we look at when people were infected, we see that the infections that we're experiencing now began 22 November and peaked 27 November. Now we are seeing a decline from the end of December holiday period through 17 January. So this has resulted in declines both in the 7-day and the 14-day averages from the peak in late December and early January through today. If we look at age groups for both lab-reported infections as well as date of infectivity, ages 25 to 49 continue to contribute the highest number of cases compared to any age group. The decline in some, let's see. Okay. So the decline in our cases is very encouraging, but we are still up to 5 times higher than we were if we look at the period prior to the end of the year holidays. Moving to hospitalizations, cumulatively we have 4,171 hospitalizations. 70% of those are occurring among those 50 years of age and older, and an additional 45% are occurring in that age group 65 and over. An interesting shift in population demographics. Whites have now surpassed African Americans with respect to hospitalizations. This is 45.4% versus 40.3%. Now that is based on the total number of hospitalizations reported. If we looked at that in terms of a rate, we would still see the disproportionality among the African American community. As of today, in the last 24 hours, we have 249 individuals that are currently hospitalized. This is not the height that we saw back in December, but it is still far elevated when we compare it to the pre-holiday hospitalization rates. The hospitalizations and emergency department visits comparing COVID-19 to influenza. Currently, we are at a 4.5 to 1 ratio of COVID-19 to influenza. If we look back at December 27th, that ratio was 9 to 1. So we did see a dramatic increase on December 27th in terms of hospitalizations. If we look at death, as of 10 January, we reported the 4th highest day on record for mortality with 24 deaths. This is particularly showing up in those that are 65 years of age and older. However, we now are observing deaths in every age category. So while 65 years of age and older are still disproportionately affected with respect to mortality, death attributable to COVID is starting to move into the early age groups. We are seeing a continued trend in an increased mortality among African Americans. The African American community is 1.5 times more likely to die of COVID-19 than their white counterparts. We report 80% of those that have died do have underlying conditions. This is a decrease from the 90 plus that we were reporting a couple of months ago that had underlying conditions. So the influence of underlying conditions appear to also be increasing. And if we look at mortality, 32% of mortality is attributed to long-term care facilities. The other metric that we look at is our percent positives. So our percent positives being reported today is at 12%. That is down from the nearly 20% positivity rate that we were reporting in late December and early January. However, this is twice or double the proportion of positives that we were seeing at its nadir back in October. The cumulative number of deaths reported so far in Mobile County are 574. If we overlay our cases with our hospitalizations and our deaths, we can predict almost to the day when we see a spike in cases, we're then going to get a spike in hospitalizations, and then those hospitalizations are going to result in more deaths. This is potentially very problematic when we look at the two new emerging strains, which are causing an increased infectivity rate for COVID-19. If we look at our map, based on rates of COVID-19, we are seeing heightened issues in the 36602, 36615, and 36607 zip codes, again based on rates. Now we'll turn to the vaccine portion. The availability of vaccines in the state of Alabama remains critically low. The Mobile County Health Department received no COVID-19 allocations last week, and we have yet to receive any allocations for this week. We are anticipating having availability for Wednesday of 870 doses in our advertised clinic. This will be reserved for individuals between 9 and 11 that were part of the 855 ADPH appointment line. Mobile County Health Department has not canceled any appointments by ADPH. However, we are going to try to clear the list of 380 individuals that were on that list on Wednesday morning. At 11 o'clock, we will then open vaccinations to those that meet current vaccine eligibility. If you have not been contacted by Mobile County Health Department and do not appear on that 855 list, you will not be allowed to enter the building and you will be asked to exit the queue. So please do not queue tomorrow afternoon at 4 o'clock because we need to take care of those that were unfortunately handled by Alabama Department of Public Health. We will also be doing a clinic on January 29th. This is a second dose only clinic. There is no allocation for primary dose. Again, these are boosters only for those that received their primary dose between December 28th and December 31st. All right. I've had some questions about the dosing and where you can receive your secondary dose if you received your primary dose somewhere else. If you received your primary dose in another state or county, you need to return to that point of vaccine distribution to receive your second dose. When you bring us the CDC card and it does not show where Mobile County Health Department vaccinated you, we do not have an allocation for you for that doses. Okay. Just want to talk a little bit about vaccine safety. There have been reports coming out of Norway, out of California, out of Florida, of vaccine deaths and some hypersensitivity reactions. CDC just published the rate of hypersensitivity after receiving vaccines. It is extremely low. This is 2.5 cases per million doses administered. There were 11 cases reported in total. Of those, 9 were identified within 15 minutes of the vaccine allocation. There have been reports of 23 deaths in Norway among the old and the frail. WHO and the Norwegian government have been investigating those. They have investigated 13 of the 23 cases reported. They have found no link between the vaccine and these occurrences. For perspective, there are 400 deaths per week in nursing homes in Norway. This is a bit confounded when we look at deaths among those being currently vaccinated. We expect higher death rates in general among this group, and this is the group that is being targeted for vaccination. So again, to date, there has been no link in Norway or in California or any of the reports that we are tracking of deaths attributable to either the Pfizer vaccine or the Moderna vaccine. There are currently 3 variants that are circulating globally that are considered new variants. However, 2 of them are very closely related. The first is the UK variant. It is termed B.1.1.7. The other one is the South African variant. It is B.1.351. What's important here is Moderna released this morning that their vaccine may not have full efficacy against the South African strain. However, the level of efficacy is still beyond what was expected coming out of the clinical trials, and both vaccines available are still efficacious against the UK and the South African strain. I also had a couple of questions that came through as we were doing the vaccination clinic. I just want to be very clear that there is no virus in the vaccines that are being administered. The other thing that I need to clearly communicate is after you receive your second dose, you still need to wear your mask, socially distance, and do the other mitigation activities until we reach herd immunity. In Mobile County alone, that means we need to vaccinate 330,000. If Mobile County was a closed system, we could stop there, but it's not. We need to vaccinate between 70 and 80% nationally before our country reaches 80%. Before our country reaches herd immunity. So focusing on a small pocket to try to reach herd immunity when 2 minutes away is another state is not the concept of herd immunity. Okay. All right. We've had some questions about individuals going to other states and people from other counties and other states coming to Mobile for vaccination. And are we concerned with that? Well, the primary concern is not really with the health department, but it's our concern for those individuals that went out of county to be vaccinated, because you have to return to that area to be vaccinated. You do return to the place that it's shown on your card. So this is not an issue at the public health level. When we look at the number of individuals that have come into at least our vaccination pods, point of delivery, we've had 15 individuals from out of state that have come to us for that. There are no vaccine residency requirements. That's because this is a federal program. So regardless of what you hear about governors in Florida restricting or mayors restricting, we cannot restrict based on federal law and state of Alabama law to give vaccines to local residents. As much as we would be in favor of that, we cannot do that. The reason we are in favor of only vaccinating Mobile residents is because vaccine allocation and resupply is based on census data from Mobile County. So when others come into our state, that's problematic for vaccination. When they go other places to be vaccinated, that's not really a concern. I had a media question around police and pregnant women being vaccinated and the concern of pregnant police officers. So initially, the guidance was that pregnant women and those that are lactating or plan to become pregnant should not receive the vaccine. And this was based on the lack of data coming out of the clinical trials. Now, the American College of Obstetrics and Gynecologists do recommend that women who are pregnant, plan to be pregnant, or lactating receive the COVID-19 vaccine if they fit the eligibility requirements. So if you have a complicated pregnancy, or if you have any other health conditions, pregnant or not, that you have concerns with, please consult with your healthcare provider around being vaccinated. I had a question from the media about a new app that is being rolled out called ShareSafe. ShareSafe is an information sharing technology platform. It was initially used for looking at bloodstream infections and sharing information in terms of best practices. Currently, there exists within Alabama in the COVID-19 vaccination paradigm a network of information that comes from CDC and that we distribute through our two means of communication, mch.org and 410-MCHD as a phone number on terms of eligibility, when you can be vaccinated in upcoming clinics. This is an opt-in platform. So this would need to be driven by Alabama Department of Public Health and have opt-ins from all the major hospitals, county health departments, and anybody with vaccines or treating COVID patients for this to be a benefit As of right now, it appears to be very nice marketing. I'm sure people will look at that in terms of utility for us at this point. Unless it's making vaccines, it's not high on our list at this point. I did have some questions about Walmart and how they fit into this, as well as other potential pharmacies like Publix in Florida, how they may come into this in terms of distributing vaccine. So currently, Walmart is being utilized by Alabama Department of Public Health as a vaccine distributor. I do not know the specifics of that. From what I understand, this will be one method of reaching areas that are not covered well by the existing infrastructure, and vaccines that are not being used in some areas of the state may be reallocated through the Walmart system. To give you an idea of volume expected, Walmart is expected under this paradigm to administer 300 vaccines a week. We do 1,200 vaccines a day. So, little different paradigm. The other paradigm with Walmart, though, is directly from the federal government, and it does look like Walmart will be included along with CVS and Walgreens as receiving vaccines directly and setting up their own distribution in parallel with the hospitals, with local pharmacies, and with county health departments. So that's all the questions I had and the updates I had. Mark, do you have any questions?
It was just one, but they answered it about the 90-day, waiting 90 days if you've been exposed or had COVID before you get the vaccine.
So a couple things about contraindications in terms of receiving the COVID-19 vaccine. The first contraindication is that you cannot receive the COVID-19 vaccine if you have received any other vaccination within the last 14 days, or if you have received monoclonal antibody therapy for COVID-19. Now, monoclonal antibodies are used for different things. This is specific to you being infected with COVID-19 and you went into the hospital and you were infused with COVID-19 monoclonal antibodies. We've also had some questions around, can I be vaccinated if I've had COVID-19 in the past? The answer to that is yes. There does not appear to be any issues with vaccines if you've gotten wild-type infection with COVID-19. However, the current directive from Alabama Department of Public Health, and this is strictly to conserve vaccine supply, is to wait 90 days. You should have IgG and IgM immunity to cover you for at least 90 days. It's likely that that will be extended to 180 days. But these are not contraindications due to health. These are that contraindication is strictly to try to conserve as much as possible the vaccine supply. All right, that it? Very good. So we want to thank everyone for their questions. Our two sources of information is 251-410-MCHD or mchd.org and click on the link for COVID-19 vaccine information. So thank you everyone for your attention. We'll be back tomorrow with the COVID-19 vaccine update, and then we'll be back on Friday with our COVID numbers. So thank you again.